We are back again. This is Dr. Machu, a physical therapist. And yes, we are here at Jackson, Tennessee, and we are here interviewing Miss Carrie Brawley. We'll be back in a few seconds. We're going to ask her who she is, what does she do at Unity Psych Hospital. Okay, we'll be back. All right, we are back here at Jackson, Tennessee. We are here at the Alzheimer's Conference. I'm here with Miss Carrie Brawley, and we're going to ask her who she is, what does she do here at in Unity Psych Hospital. So again, Miss Brawley, could you please tell us again who you are, what you do at the Unity Psych? I hope you're not a resident, right?
No. I'm Carrie Brawley.
Mhm.
I work at Unity Psychiatric Care Hospital in Martin, Tennessee. It's a 16-bed geriatric psych unit, and I'm the administrator.
Perfect. So you mentioned about, we talked about psych hospital. So right now we're here at the Alzheimer's Conference. What qualifies you, not you, a person to be admitted in the psych hospital? What are the services that they provide there? Do you have a physician there, a psych nurse? Are they trained to deal with psych issues, depression, behaviors? How does that work?
Yes, the majority of our patients have some form of dementia, and there's usually having some type of behavior, and they come in either needing their medications adjusted or they just need to be given an assessment to make sure maybe it's where they need to be placed after hospitalization. So the majority of our patients are coming in due to some type of behavior associated with the dementia. And this could be depression, it could be verbal or physical aggression. There's many types of behaviors that a patient with dementia might have. And yes, we do. We have several providers at our hospital. We have our clinical team, and then we also have our medical doctor, our psychiatrist, and psychiatric nurse practitioners.
Perfect. Well, you mentioned about verbal and then physical. So can they just walk in? We got a family member. Hey, they're having behaviors. Can they just call you and then walk in, or do they need to get a prescription from their doctor? Need to be admitted at the acute hospital? How does that work, Miss Carrie?
That is a great question. We have actually an intake system where people can either call our hospital number, which is 731-588-2830, and speak to Ms. Jessica Eaton.
And Miss Jessica.
Yes, and she will help them get the information they need to get to our providers to make sure that the patient is appropriate for inpatient hospitalization.
So you said appropriate. So what is the appropriate diagnosis? You said dementia and behaviors and stuff like that. So just for example, I have a family member, they're being verbally and physically, aggressive. So just call you and then do the intake form. And how fast can they be admitted? Is it just like I know this is an acute hospital. Can they be admitted right there and then, or is there like a day or two waiting, or how does that work?
What we do is during our intake process, we will reach out to the patient's physician or who's been caring for the patient to get some medical information on them, and also to make sure that we get a good assessment before bringing them in. But actually, once we get that criteria, the admission process is very, very fast.
Quick, yeah.
Once we have that information, once we talk to our psychiatrist or our psychiatric nurse practitioner and they see that the patient is appropriate for admissions, that process goes really fast. That's when we contact the family, let them know that, the provider has said to admit and the patient is brought in. Because we understand that most of the calls we get are families in crisis.
Mm.
So they don't have a lot of time to wait. So that's why we try to make the admission process
Quick
as
as
simple
possible.
and as quick as possible for the caregiver.
It's funny you mentioned that. I was going to ask you, most of the patients or people we know at home or in the community, they are encountering a crisis, and the team at Unity are certified in CPI, Crisis Prevention Institute, and the dementia practitioner people too. So it's very important that when you go to a psych hospital or any kind of acute hospital, that the people are trained, because not all hospitals are equal, to be honest. Not all therapy is made equal. So you need to find an appropriate facility, clinic, practitioner who specializes in Alzheimer's and dementia. And this is one of the many psych hospitals or few psych hospitals that we have in the area. So Ms. Carrie, another thing. So when they're admitted already, what kind of activities do you do? I know you do medication management. I know Dr. Carr, the psych nurse, and everything there who does the medication. What are the different activities that you guys do there? I remember you got lots and lots of nice activities there.
We're excited because our hospital has just recently been renovated.
Mm-hmm.
So it is dementia friendly.
Mm-hmm.
It is decorated to basically to stimulate them. It's an environment for them. So one of the things is our social services and our activity therapists, they'll do assessments on admission to see, what the patient likes or prefers as far as activities. And our patients spend the majority of their day in group therapy. They are participating in activities throughout the day. This goes from like 9 o'clock in the morning till 3 o'clock in the afternoon with lunch breaks. But our purpose is to keep them busy, keep them stimulated throughout the day. Also make sure that the regimens that the providers have saw that's what they need, that it's working appropriately. So like I said, we try to keep them really busy in activities that they can relate to, but also so our providers and our clinical team can see how the medications are working or how they're doing in a group setting. Because most of our patients do come from group settings. So we want to make sure that they can go back to their group settings and have that quality of life that they need.
Perfect. I love what you said there. It needs to be personalized. That's why they have what you call have the care planning. When you go there, when you find a facility and they're doing generic stuff, you just don't do that. Because imagine me, I'm a little Filipino guy, and then bringing me in a psych facility or whatever hospital, and I don't do what they do there, I'm just going to have behaviors again. So it needs to be personalized, and that's what they do there. They do a very careful care planning, identify what the wants and needs and what the preference of that person. If they prefer to wake up at 9, why wake them up at 6? And they get behaviors again. And then here you are trying, they have behaviors, but of course you woke me up at 5 in the morning. I wake up at 6 or 7. No, I wake up at 9. Just kidding. But you know what I mean? It's very important that you find that facility that knows how to care plan properly. So they do medication, right? Quality of life. She mentioned about that. Activities is very important. Activities is very important because they need to be stimulated. That's like the word that she said. Not just the food stimulation. You need to have that brain stimulation too. That's why we're encountering a lot of dementia in people who are retiring because their brain is not stimulated. There's a time and place for you to stimulate and inhibit. If they have behaviors, you kind of inhibit it. If you cannot inhibit or decrease their agitation, you redirect them. That's what they do. I've seen Miss Carrie in action, and she is so good at redirecting. She redirects me. She redirects Richie. So, but as kidding aside, she does that, and she's amazing in doing that. Miss Carrie, any last parting wisdom for the people who are needing help with psychiatric hospitalization? Where can they find you and stuff like that?
Oh, absolutely. Just to let people out there know that there is help. You're not alone. I know that you may feel alone because when you're caring for someone with dementia or Alzheimer's, it isolates the caregiver too. But we want people to know that you're not alone. And if you feel like that your loved one is appropriate for an assessment or evaluation, just give us a call. We're located right in Martin, Tennessee. And you can call us at 731-588-2830. My name's Carrie, or you can ask for Jessica.
There you go. So can any patient from outside of the state or in the different parts of Tennessee can go be admitted, or
The majority
Mhm.
we have had out of state
Mhm.
patients. Of course, we'll go over with the family their insurance. Sometimes there's certain insurance plans that are state specific, but if they're living with their caregiver, say in the state of Tennessee, but they're not from Tennessee, maybe they're just here because they need to stay with someone, we can verify that insurance.
Perfect. Again, thank you very much, Ms. Carey.
You're
Appreciate you. I know you're a
welcome.
very
Thank
busy
you.
woman.
Bye,
But
guys.
before I let you go, always remember the word FAST. FAST. Letter F. Find a facility that will bring out the best in you. You know, it's very important that you find a facility that is appropriate for your loved ones. You know, talk to Miss Carey. Go to her website, UnityPsych.com. You know, find that facility. It's very important that you're finding people that it's going to bring out the best in you. Next letter is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Miss Carey good if you don't take action. Take action by reaching out to her. You know, talk to her, Miss Carey, Jessica, the rest of the team there. You know, you may not be admitted today, but at least you know not you, okay, the family member. At least you have the resources. It's very important that you have the resources in place. And I like what they do there. Every time I used to work for them too, and and they would put down all their resources for those clients. So it's very important. Next letter is letter S. Share and subscribe. The more shares, the better. Share it because it may not be applicable to you right now, but it could be applicable to someone else or in the future. Okay. And last but not least is letter T is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. And that's what Miss Carey is doing. She's teaching us how to understand Alzheimer's and dementia. Again, thank you very much, Miss Carey. Appreciate you. Be awesome, be great, be excellent, and we will see you on our next episode of our Jerry Hab Show. Bye bye.